My name is Dr. George, and this is Dear Doctor. I'm definitely sure you've had to go to the hospital when you were sick and then they ran some tests and told you that you had malaria and typhoid. Well, you had to bust your bubble. You probably didn't have typhoid. Maybe it was just malaria. This series will be busting all the myths and things you thought you knew about your health and things doctors and laboratory scientists told you about your health. Well, I'm here to tell you, you were wrong. Now listen to me. Malaria is about the oldest disease we've had on Earth. Mosquitoes have been here prior to our arrival, as a matter of fact. If we go by Darwin's, they have been here since World War I, World War II, and no, interestingly, we still haven't conquered malaria. Southern Sahara part of Africa is very endemic for malaria, and so if you try to do a test for everybody in Nigeria, you definitely find a plus or two of Plasmodium falciparum. But you are not likely to find Salmonella typhi. Salmonella typhi is the causative organism for the typhoid that everybody proclaims. You are always told you have typhoid and malaria because of how the test is done, and I will explain. I don't want to bore you with all the medical jargons, but listen, if I have to peep into a room through a small hole and I see a white color, I'm likely to assume that the colors of the room or the paint of the room is white. And so I will turn and tell whoever sent me that that room is white. But if I'm giving a wider view, I probably notice that there's just a white little piece of paper blocking my view. That's the picture you have when they do a Widal test. That's the test they do to confirm that you have typhoid or not. It's an old test that is not really specific, but it is sensitive. It tells you that something is wrong, but it doesn't really tell you exactly what is wrong. And so to be on the safe side, they have to tell you that you have typhoid so you can take some antibiotic and feel fine. Well, you eventually get to feel fine and you believe them. Now listen, Salmonella typhi is fecally transmitted. In fact, it can be transferred from person to person. Most persons who have to cook in eateries and public places have to be tested severally for typhoid, tuberculosis, and all that. That gives you a clue of what I'm talking about. I'm sure you're getting the picture. So, when you do a Widal test, there is a panel. You have typhi A, B, C, and D, and the titers are measured from 20 to 80. That's what I was talking about. However, most of the times we clock between 40 and 60. We don't even get up to 80 or 160 in the titers, and they have to tell us that we have typhoid so we can take some antibiotics. Next time you get to the hospital, you're complaining of fever, headache, malaria. The thing is, these symptoms also look like the symptoms of malaria, and so it's not very easy to push each aside. And sometimes, after you must have taken the malaria medication, you still have some sort of headache troubling you and mild fever, and you're wondering, did I take the wrong drugs? And then they tell you, oh, you didn't treat typhoid together with the malaria, and that's the problem. And then they give you some more antibiotics, and then eventually you get better, and you have all the more reasons to believe them. That can work, but there is usually a bacterial load. These are living organisms growing in your body. Just like the way you hear about HIV viral load, there is always a quantity of these living organisms in your body that needs to be cleared. So, just the way a HIV patient keeps taking the medications they get because they never completely get rid of the virus, that is how this also requires a certain degree of intake of the antibiotics to completely clear them. However, we are also always exposed to the contamination points. You picked up this bacillus from somewhere, but you've not even done some sort of contact tracing to know how you picked up the Salmonella typhi. and so you also are exposed all the time. You keep taking them in and you have to come back for medications. So please understand it now. You do not really have typhoid. It's most likely malaria infection from Plasmodium falciparum that you have, not the Salmonella typhi. I'm sure you still have several other questions you want to ask me around that. We'll go on a short break. When we come back, I'll be willing to take your questions, should you have any. Feel free to reach out to me on the social media handles shown on your screen right now. We're back. My name is Dr. George, and this is still Dear Doctor. I've gotten some messages already. Someone is asking, Doctor, I was at the hospital the other day. I had a fever. My head was really banging in quotes. Now, when you have these symptoms, his question actually is, should he have treatment for malaria and typhoid? Now, when you have symptoms like this, you did the right thing by going to the hospital. Wonderful. However, you're supposed to keep an open mind and have them do what they have to do. Just keep at the back of your mind what you've learned today. That you have these symptoms, do not conclude that you have typhoid. Of course, they're going to run some tests. Of course, they're going to give you medications and tell you, likely from whatever hospital you went to, that it is malaria and typhoid. Just bear in mind that you're doing the right thing. When they give you your medications, take them and you will be okay. However, understand, even if they write on that paper, malaria and typhoid, you do not likely have typhoid. But you're not going to get hurt by taking the antibiotics they will give you, unless you have some other conditions that do not indicate the use of the particular antibiotics they may have given you. Feel free to relay the information to your doctor, and I'm sure your doctor will be very glad to make some adjustments and take you more seriously and give you the adequate care that you actually need. I have another question. She's saying she's had this headache for a long time. She's treated malaria and typhoid, and the headache just doesn't go away. The thing about headache in particular is that it could come from different sources, not just malaria and typhoid. Some persons with elevated blood pressures have headache. Some persons who are undergoing stress have headache. A lot of things can contribute to that. How about you get to the doctor to do a full general examination on you and run some tests? That would be able to discover the source of the headache, and then the appropriate treatment would be given. Just like you've experienced, it wasn't malaria, it wasn't typhoid, because you still have the headache. So how about the doctor does several different other things that can be done for you, and eventually the cause of the headache will be found and you'll get your required treatment, and eventually you'll be fine. Thank you very much. I'm sorry this is the much we can take for today. However, feel free to reach me on this same channel at this time of the week again. I'm definitely here waiting for you with several other myths I want to bust. Your health is in good hands. I'm still Dr. George, and this is Dear Doctor.